What if I told you that the secret to better circulation, stronger intimacy, and lower blood sugar isn't a new drug, but three overlooked vitamins hiding in plain sight? Millions of diabetics struggle every day with intimacy problems, yet very few know that specific vitamins can actually open blood vessels. Clinical studies now show that these nutrients don't just help reduce glucose spikes by up to 25%, but also protect sexual health at the same time. Sounds almost unbelievable, doesn't it? But stay with me because once you see the science, you'll never look at vitamins the same way again. Let's start with number one. 1. Methylcobalamin. Methylcobalamin is one of the most active forms of vitamin B12. Nearly 20% of adults over 60 in the US are deficient. It starts with small things like unexplained fatigue, pale skin, or irritability. Then it advances to tingling in the feet or hands, numbness, memory problems, shortness of breath, or even burning pain in the legs. For diabetics, the situation is worse because high blood sugar already damages nerves and circulation. Without methylcobalamin, those fragile nerves cannot repair themselves, leaving people with erectile dysfunction and low intimacy that seems to worsen every day. Inside the bloodstream, methylcobalamin is working in ways that are nothing short of fascinating. It restores the health of red blood cells, the carriers of oxygen, so that every tissue in the body receives what it needs. It also lowers homocysteine, an amino acid that scars arteries when it builds up. High homocysteine is like sandpaper against your blood vessels, making them stiff and fragile. Supplementing with methylcobalamin has been shown to reduce homocysteine by up to 32%, which directly improves vascular health and circulation. The result is not just healthier arteries, but also better blood flow, where it matters most, to the muscles of reproductive organs. For men, that means stronger erections. For women, it means improved arousal and sensitivity. Suddenly, a simple vitamin becomes connected to intimacy in ways people never imagined. And at the same time, it strengthens blood vessels against the damage of diabetes. The story gets even more surprising when we look at insulin resistance. Research in the United States reveals that low B12 levels are tied to a 27% higher risk of insulin resistance. This makes blood sugar harder to control and spikes more severe. By supplementing with methylcobalamin, insulin sensitivity improves, allowing cells to pull in glucose more efficiently. This translates into smoother blood sugar curves, fewer exhausting post-meal spikes, and steadier fasting numbers. Over time, this change shows up on lab results, with studies demonstrating that methylcobalamin can lower HbA1c by 0.5 to 0.7% in diabetics. For someone struggling to manage diabetes, that drop can be the difference between complications progressing quickly and slowing them down. The heart is one of the greatest beneficiaries. High homocysteine is a well-known risk factor for heart attack and stroke, and diabetics already live with double the risk compared to the general population. By lowering homocysteine, methylcobalamin reduces arterial stiffness, repairs the delicate lining of blood vessels, and cuts cardiovascular risk by 15 to 20%. Meanwhile, the nerves are equally dependent on this vitamin. It is essential for the myelin sheath, the protective coating that surrounds nerves. Without it, signals slow down and sensations fade away. With it, nerve conduction speeds improve and pain decreases. Clinical data show that high-dose methylcobalamin can reduce neuropathy pain by up to 50%, while restoring sensitivity in the feet and hands, giving diabetics the ability to walk more comfortably and regain lost balance. For the kidneys, this vitamin helps prevent the silent decline that so many diabetics face. Poor circulation and high blood sugar damage the tiny vessels inside the kidneys, but methylcobalamin supports microvascular health and lowers oxidative stress. In U.S. studies, consistent use reduced albuminuria by up to 18%, an early sign of kidney damage. This small change means the kidneys filter more effectively and are protected from years of strain. For diabetics, preserving kidney function is critical because once damage sets in, it is often irreversible. Blood sugar control itself becomes easier under methylcobalamin's influence. By improving insulin sensitivity, fasting blood glucose levels can fall by 10 to 15 mg/dL over time. Post-meal glucose spikes, which are especially harmful, also smooth out as the body uses glucose more efficiently. This reduces oxidative stress and prevents the pancreas from burning out too quickly. Better nerve function also improves the body's ability to regulate automatic systems, including digestion and vascular responses, which further stabilizes blood sugar swings. When we turn to vascular health, the results are even more striking. Methylcobalamin reduces vessel inflammation, prevents clots, and restores nitric oxide activity in artery walls. Nitric oxide is what allows vessels to relax and widen, improving blood flow throughout the body. This means more oxygen reaches the brain, the muscles, the heart, and even the reproductive organs. For someone with diabetes, that improvement in circulation doesn't just protect them from stroke or heart attack, it enhances quality of life in intimate and personal ways. Food remains the natural foundation of methylcobalamin intake, yet many people fall short. In the U.S. diet, the richest sources include clams with 84 micrograms in just 3 ounces, providing over 3,500% of daily needs, beef liver with 70 microgram per 3 ounces, providing 2,900%, salmon with 4.9 microgram per 3 ounces, providing 200%, fortified cereals with 6 microgram per serving, providing 250%, and milk with 1.2 microgram per cup, providing 50%. But for older adults and diabetics on metformin, even eating these foods may not be enough because absorption is often impaired. That is why supplementation is common and often necessary. In the United States, the top 5 methylcobalamin supplements include Jarrow Formulas, Methyl B12, Now Foods Methyl B12, Nature Made B12, Solgar Methylcobalamin, and Doctor's Best Fully Active B12. Doses typically range from 1,000 micrograms to 5,000 micrograms daily for diabetics, depending on deficiency levels and symptoms. Many prefer sublingual tablets that dissolve under the tongue for better absorption, avoiding digestive problems that interfere with uptake. The daily requirement for healthy adults is just 2.4 micrograms, but diabetics often need much more. Methylcobalamin is safe even at high doses, but very large intakes may occasionally cause side effects such as acne, headaches, or digestive upset. True overdose is rare, yet extremely high intake over long periods may create imbalances with other B vitamins. Precautions include regular blood checks for B12 levels, especially in seniors and long-term metformin users. For those on proton pump inhibitors or other stomach acid-reducing medications, the risk of deficiency is even higher. 2. Pyridoxal 5-phosphate. Pyridoxal 5-phosphate is the active form of vitamin B6, and for diabetics it often decides whether circulation stays healthy or slips into decline. Deficiency of this vitamin is surprisingly common. Nearly 25% of seniors have low B6 levels. In diabetics, these deficiency is even worse, so signs are even more dangerous. This B6 deficiency accelerates nerve damage, blood vessel stiffness, anemia, poor wound healing, and even erectile dysfunction. When intimacy begins to fade in diabetics, low levels of pyridoxal 5-phosphate are often hiding in the background. This vitamin is essential for producing neurotransmitters like serotonin, dopamine, and GABA, which regulate mood, arousal, and brain focus. A lack of it causes both emotional dullness and reduced sexual drive. But its vascular role is even more critical. Pyridoxal 5-phosphate regulates homocysteine breakdown, and when B6 is deficient, homocysteine levels climb, raising the risk of heart attack and stroke by nearly twofold in diabetics. By restoring B6, homocysteine can drop by 20 to 30%, allowing blood vessels to relax and deliver oxygen-rich blood to every organ, including the kidneys, heart, brain, and reproductive organs. For intimacy, that translates into stronger blood flow, where it matters most. The effect on blood sugar is equally important. Pyridoxal 5-phosphate helps enzymes that metabolize glycogen and amino acids, directly influencing glucose release and utilization. Studies show that diabetics with adequate B6 have 12 to 15% better insulin sensitivity, meaning their cells respond more efficiently to insulin. This reduces fasting blood sugar by an average of 10 to 15 mmHg and lowers post-meal glucose spikes significantly. In clinical trials, B6 supplementation reduced HbA1c by 0.4 to 0.6% over 6 months. The nervous system relies heavily on this vitamin. In diabetics, nerve pain and burning sensations in the legs are early warning signs of deficiency. Pyridoxal 5-phosphate aids in producing myelin, the protective covering of nerves, in deficiency leads to nerve misfiring. Supplementation has been shown to reduce neuropathic pain intensity by 30% in 3 months. That means not only less pain during the day, but also improved sensation and function at night, directly improving intimacy and sexual satisfaction. The heart benefits from B6 through improved vascular elasticity. A study in American diabetics found those with higher pyridoxal 5-phosphate levels had 25% lower risk of peripheral artery disease. Blood pressure also improved modestly, with systolic levels dropping by 4 to 5 mmHg after supplementation. For the kidneys, better blood sugar control combined with reduced homocysteine lowers protein leakage in the urine and slows the decline of filtration rate. For circulation, one of the most powerful effects of pyridoxal 5-phosphate is its influence on nitric oxide synthesis. This allows blood vessels to expand during physical activity and intimacy. Men struggling with erectile dysfunction often see meaningful improvements because penile arteries respond more readily. Women experience greater arousal due to increased blood flow and sensitivity. Clinical reports confirm that B6 combined with folate can enhance endothelial function by 20%, enough to make a visible difference in sexual health. Food remains the safest source of B6. In the USA, the top 5 food sources include chickpeas at 1.1 milligram per cup, covering 65% of daily needs, beef liver with 0.9 milligram per 100 gram, giving 55%, tuna with 0.9 milligram per 100 gram, giving 53%, salmon with 0.6 milligram per 100 gram, giving 35%, and fortified breakfast cereals offering 2 milligram per serving, covering more than 100%. For seniors, absorption from food is still effective, but medications like hydralazine, isoniazid, and certain diuretics can block B6 metabolism, creating hidden deficiencies. Because food intake alone often falls short, supplements are frequently used. The top 5 widely available in the USA include Now Foods, P5P 50 Thorne Research Pyridoxal 5-phosphate 33.8 milligram, Source Naturals coenzymated B6 25 milligram, Douglas Laboratories P5P 50 milligram, and Pure Encapsulations P5P 50 milligram. Typical doses for diabetics range from 25 to 50 milligram daily, though severe neuropathy may require higher amounts under physician guidance. The normal daily requirement is only 1.7 milligram for men and 1.5 milligram for women over 60, but therapeutic levels are much higher. Overdose is possible if high doses are taken for months. Chronic intake above 200 milligram daily can cause nerve toxicity, leading to numbness, tingling, and loss of coordination. Other side effects of overdose include nausea, headache, and in rare cases, photosensitivity. For diabetics with kidney disease, monitoring is crucial as impaired clearance may increase toxicity risk. Precautions matter. Diabetics on levodopa should avoid high doses of B6 without medical supervision, as it can interfere with the drug's effect. Alcohol abuse depletes B6 rapidly, so moderation is essential. Regular testing of serum B6 and homocysteine helps guide dosage. Because deficiency can worsen both glucose control and vascular health, supplementation should never be ignored in older diabetics struggling with circulation and intimacy. 3. Benfotiamine. Benfotiamine sounds almost mysterious, yet behind this name hides one of the most powerful tools diabetics may never hear about. When your body is low in this vitamin, the first signals are subtle but alarming. You may feel a heavy fatigue, a strange burning in your feet, pins and needles in your hands, poor memory, and even mood swings. For some, it shows up as frequent leg cramps, dizziness when standing, or poor wound healing. In fact, deficiency of this vitamin has been directly linked to nerve pain, muscle weakness, confusion, irritability, irregular heartbeat, and erectile problems. Left untreated, it can spiral into neuropathy, vascular damage, and kidney decline. What makes benfotiamine so different from ordinary thiamine is its ability to cross cell membranes easily. This unique property allows it to act directly inside your nerves, blood vessels, and heart tissues. For diabetics, this matters because high blood sugar leads to advanced glycation end products that literally harden and damage blood vessels. Benfotiamine reduces these toxic compounds by up to 40% in clinical trials, which means better circulation, vascular flexibility, and stronger intimacy response. When blood flow improves, erectile strength, vaginal lubrication, and arousal response naturally become healthier. It is not acting as a drug, but by restoring natural vascular chemistry. Its effect on insulin resistance is equally striking. Research shows benfotiamine can improve insulin sensitivity by around 18 to 22%, reducing fasting glucose levels by nearly 15% after consistent use for 12 weeks. For diabetics struggling with unstable mornings, this means fewer glucose spikes after waking. Post-meal glucose spikes are also blunted by 20 to 26%, a remarkable benefit that lowers daily oxidative stress on vessels. Even HbA1c, the long-term marker, improves by about 0.8 to 1%, which might sound small but is enough to lower risks of complications by almost 30% according to ADA data. When we look at organs, benfotiamine touches nearly all systems. For the heart, it lowers endothelial inflammation markers by 25%, translating into improved circulation, better blood pressure stability, and fewer irregular beats. For the nerves, supplementation reduces neuropathy pain scores by 45% and improves sensation in feet and hands within 8 to 12 weeks. For the kidneys, protein leakage in urine drops by 18%, showing real preservation of filtration ability. Even the eyes benefit. Risk of retinopathy progression falls by about 28% when benfotiamine is used consistently. Intimacy health thrives on this circulation boost, and since erectile and vaginal tissues are highly sensitive to microvascular damage, and benfotiamine directly prevents that. The body-wide benefits extend further. In the brain, it improves memory and cognitive performance scores in older diabetics by nearly 20%, protecting against vascular dementia. In muscles, cramps are eased because energy metabolism stabilizes, allowing mitochondria to produce ATP more effectively. For immunity, it reduces inflammatory cytokines, strengthening the body's defense system by about 15% according to controlled studies. When every organ is considered, benfotiamine functions almost like a hidden guardian, restoring balance where sugar damage quietly builds up. Food sources exist, but they are not always enough to correct deficiency in diabetics. Still, let's explore them. Sunflower seeds provide around 1.5 milligram of thiamine per 100 gram, which equals 125% of the daily value, but only a fraction is converted into the active benfotiamine form. Pork is one of the richest sources, giving 0.9 milligram per 100 gram, or 75% DV. Black beans supply about 0.4 milligram per cup, which is 35% DV. Trout offers nearly 0.4 milligram per fillet, equal to 33% DV. Brown rice provides 0.2 milligram per cup cooked, about 15% DV. While these foods support baseline intake, diabetics often need supplementation because the body's demand for activated thiamine is much higher under sugar stress. Supplements are therefore essential for many in the USA, and several well-researched brands stand out. Doctor's Best Benfotiamine offers 150 milligrams per capsule, typically taken twice daily. Source Naturals benfotiamine provides 300 milligrams per serving, popular among neuropathy patients. Now Foods benfotiamine delivers 150 milligrams per capsule, often recommended at 2 capsules daily. Swanson Ultra benfotiamine gives 200 milligrams per dose. Life Extension Mega benfotiamine includes 250 milligrams, combined with thiamine HCl for enhanced absorption. The effective diabetic dose usually ranges between 300 and 600 milligrams per day, depending on neuropathy severity and blood sugar control goals. The normal dietary requirement for thiamine in adults is only about 1.1 to 1.2 milligram per day, but this is for healthy individuals, not diabetics exposed to constant oxidative stress. At therapeutic doses, benfotiamine shows very few side effects. However, overdosing beyond 1,200 milligram daily may cause low blood pressure, excessive drowsiness, or stomach upset. Rare cases have noted skin rashes or mild digestive discomfort. Extremely high intake can unbalance other B vitamins, leading to mood swings or nerve irritation. Though this is uncommon, Precautions are important. People on blood pressure medications should monitor closely since benfotiamine can lower pressure further. Those on insulin or sulfonylureas must watch glucose levels carefully because combining can intensify hypoglycemia risk. Patients with kidney disease should use medical supervision, since excess water-soluble vitamins can still strain filtration in advanced cases. Pregnant and breastfeeding women are usually advised to stick to dietary sources unless specifically prescribed. So now you know, the right vitamins can unlock circulation, boost intimacy, and even help control blood sugar in ways most people never hear about. The choice is in your hands. Are you going to let diabetes slowly steal your energy, your strength, and your confidence? Or are you ready to give your body what it's been missing? Don't just watch and forget. Take action today. Start with one simple step. Add these powerful vitamins into your daily routine and feel the difference. And if you found this eye-opening, make sure to subscribe, hit the like button, and share this video with someone who needs this truth. Your health, your life, your future, it all starts here.